Digestive problems are a common complaint. A new large multinational study finds 40% of us have what is called a functional gastrointestinal disorder. Dr. Christina Captain runs the Sarasota Center for Acupuncture Nutrition and is here to explain how natural medicine can help. I mean, functional or not, nobody wants to be walking around with digestive disorders. You know, I mean, it's uncomfortable. So what kind of symptoms are we concerned about?
My gosh, we're concerned about so many things, right? But what shows up for me, nausea, vomiting, okay, but lots of nausea, just abdominal pain and bloating, right? Alternating constipation and diarrhea, or one major of the other one. I mean, half the country's either got constipation and the other half has diarrhea.
It's
right?
going one way or the other, the wrong way.
And then flatulence, gas, that's just like could melt wallpaper off the wall or singe your eyebrows. That's not normal, folks.
Not good.
None of that is normal.
No one wants to be around that or have that. So how do you determine causes, though? Because it seems so hard to track down what is kicking it all off.
I think the worst thing is when patients come in and they say they can't eat anything. You know, I drink water and I have this problem. And so this really goes down to what is dysfunctional. Is it liver gallbladder with the production of bile? Is it the pancreas, the production of enzymes? Is it the stomach with low stomach acid? You know, is it leaky gut? You know, this sort of like permeation in the colon. Is it SIBO, small intestine bacterial overgrowth? So how do we figure it out? Well, of course, Eastern medicine has its own whole way, but my favorite way is to integrate functional testing, which is a stool test. And so this stool test is remarkable. It's going to show you the big pathogens like C. diff and Giardia. People carry around that all the time. It's going to show you your actual microbiome, which is the house that all your microbiota, your little bacteria live. Those are the good guys. If you don't have any good guys, your immune system's probably low. If you have too much of the good guys, then you may have a little bit more gas, right? It's going to show dysbiosis, all those opportunistic bacteria that are overgrown in the gut or the small intestine, like SIBO I just mentioned, right? Can happen in the colon as well. It's going to see if you have any parasites or you have any worms, right? And these tests are really deep. They're looking at DNA. It's not just, oh, let's look for some eggs from parasites. It's DNA. So they can look at traces or remnants of what could have been there, like the bacteria H. pylori, a bacteria that lives in the stomach that causes or is the main culprit for acid reflux, peptic ulcers, and some cancers.
I love that you can track it down through the test, right? Because I feel like so much of the time it's sort of dismissed in the, oh yeah, you know, it's your age. Lots of people have nausea, or lots of people have sensitivities to food. That's such a big phrase right now. But that you can track down things that can be solved.
And then once they have that diagnosis, or once we see what is wrong in there, then we can go in with a natural plan using plant-based substances to sort of eradicate, balance, and support organs of digestion, get rid of those bacteria. I do work, of course, with a medical doctor as well, so if they need antibiotics to kill H. pylori, we can get those. All of that is so important. And then there are, of course, some dietary changes. But if someone comes in and they're allergic to every food, they say they're allergic, maybe they're getting hives every time they eat anything, or maybe they just are, their stomach is upset, have like a dyspepsia every time they eat something, or they feel bloated. You know, when we repair and support those organs, absolutely that person is like, I can eat this again, I can eat that again, right? And acupuncture in between, during all of this protocol, which takes several months, it's not an easy peasy thing, acupuncture mitigates those symptoms on the fly, like a Band-Aid. So then you're relieving symptoms, and then you're making a permanent fix.
And I think the takeaway is you don't have to suffer from these digestive symptoms that so often people feel like they're just kind of stuck with. We have a great testimonial from someone who did find relief from these treatments.
The very first thing that Dr. Captain did for me was to change my diet. I was pre-diabetic from a family of all diabetics, and I was determined not to go on medicine if I could help it. So she put me on an anti-inflammatory diet, which immediately improved that. From there, we proceeded to helping me maintain my health and my lack of pain with the sciatica that I've had since I was a young girl. And right through to COVID, the effects of long COVID. She was the one who figured it out. Without that, I think I would still be in bed. But I am feeling so much better. Then I'm back to teaching at school, and life is good.
Absolutely.
I love that life is good, and I like how she mentioned too that you incorporate nutrition yourself.
Absolutely.
Into this.
Well, nutrition can be in two categories, just the food you eat and what you eliminate, what you incorporate in, and also any supplements that are going to help support digestion or support a nutritional deficiency. So it's really important. I mean, diet is everything, getting reduced inflammatory foods like sugar, alcohol, red meat, and then increasing plant-based foods, but not eliminating protein altogether. It's really important you get both.
And Eastern medicine always, of course, treats the whole body, which is so incredibly useful when it comes to these issues. For more information or help with any digestive issues or otherwise, you can find Dr. Captain by going to scansrq.com.